Ever wondered why some people, regardless of age, can't control their bladder? Well, let's dive into this often unspoken topic: urinary incontinence. It might seem surprising, but it's more common than you might think. Urinary incontinence is essentially a loss of bladder control. This leads to an involuntary leakage of urine, which can be a sudden urge that's hard to control, or a constant dribble. It's not just a condition that affects the elderly, it can happen to anyone, at any age. Despite its prevalence, it's a topic that many are too embarrassed to discuss openly. But it's important to remember that it's not just a physical issue. The inability to control one's bladder can have profound effects on one's social life, self-esteem, and emotional well-being. Urinary incontinence isn't just a medical issue, it's a social and emotional problem too. Let's break the silence and start the conversation. So, what causes urinary incontinence, and how does it affect those who suffer from it? Urinary incontinence often stems from physical changes in the body. Pregnancy, childbirth, menopause, and aging can weaken the pelvic muscles responsible for bladder control. Underlying medical conditions like urinary tract infections, neurological disorders, or diabetes can also trigger this condition. And let's not forget about habits. Excessive caffeine or alcohol intake, and even high-impact sports can put extra pressure on your bladder, leading to incontinence. But the effects go beyond the physical. The unpredictability of urinary incontinence can lead to embarrassment, causing people to withdraw from social activities. This sense of isolation can foster anxiety, further compounding the problem. It's a cycle that can be hard to break, but understanding the causes is the first step towards regaining control. Despite these distressing effects, it's important to remember, urinary incontinence is not a disease, it's a symptom. While urinary incontinence can be a challenge, there are measures you can take to prevent it. Let's talk about some of these preventative measures. Maintaining a healthy weight is a good starting point. Excess weight puts pressure on your bladder and surrounding muscles, weakening them over time and leading to incontinence. Practicing pelvic floor exercises, often known as Kegels, can also be beneficial. These exercises strengthen your pelvic muscles, improving bladder control. It's like doing a workout, but for your bladder. Now let's talk about your diet. Certain foods and drinks can irritate your bladder, making incontinence more likely. Common culprits include caffeine, alcohol, and spicy or acidic foods. Reducing your intake of these can help prevent urinary issues. Lastly, if you smoke, consider quitting. Smoking can lead to a persistent cough, which in turn puts pressure on your bladder and can cause incontinence. Prevention is indeed possible, but what if urinary incontinence has already knocked on your door? Good news, urinary incontinence is treatable and often curable. Treatment approaches range from simple lifestyle changes to more advanced medical procedures, depending on the severity and type of incontinence. For some, modifications such as reducing caffeine intake, losing weight, or quitting smoking can make a significant difference. Bladder training, too, can be a game changer. It involves gradually increasing the time between feeling the need to urinate and actually doing so, helping you gain more control. A powerhouse in this battle, however, are pelvic floor muscle exercises, also known as Kegels. These exercises strengthen the muscles that support your bladder, improving both stability and function. Medications are another viable option, particularly for urge incontinence. They can help control muscle spasms and increase bladder capacity. In more severe cases, surgery might be suggested to improve bladder support or control. But remember, it's crucial to consult with a healthcare professional before starting any treatment. Remember, you don't have to live with urinary incontinence. Help is available, and it's okay to seek it.